Hello, ma'am. Today I've come here to discuss about a very important topic, what postpartum depression is. So I read about it and I wanted to know more what postpartum depression means.
So, yes, since you have understood and want to know more about PPD, PPD is a mental health condition and can affect mothers after childbirth. PPD involves persistent feelings of sadness, emptiness, or hopelessness after delivery. It can begin with a few weeks of childbirth or even months later, and Surmi, it may affect with daily functioning and bonding with the baby.
Okay. So, ma'am, how do we know that someone is suffering from postpartum depression?
So, some of the common symptoms I would like to talk about here are persistent sadness, crying spells, loss of interest or pleasure in any activity, extreme fatigue or low energy, sleep disturbances beyond newborn care, feelings of guilt, worthlessness, or failure as a mother, anxiety or even panic attacks, difficulty bonding with the baby also. Also, one can get irritable and get angry at the smallest of things. Thoughts of self harm or harming the baby can also happen at times.
Oh, so we need to see if someone around us or are we having these symptoms.
Right,
If yes, then we should go for help.
right.
So, ma'am, why does PPD happens? Like, why it happens?
So let's talk about some of the causes. So PPD does not have a single cause. It
Okay.
usually results from a combination of hormonal changes after childbirth, as we all know, emotional stress and sleep deprivation, previous history of depression or anxiety, also lack of social or family support, complicated pregnancy or delivery, financial or relationship stressors can also cause PPD.
Okay. So, ma'am, a very important question. How do we help someone with a postpartum depression?
Yes, it's a good question. Support is definitely needed because PPD is treatable and early support makes recovery easier. Counseling, psychotherapy, CBT, supportive therapy, medication when prescribed by a psychiatrist. Now at SFCT, we offer support groups for pre and postnatal care, clinical hypnotherapy and self hypnosis, trauma tapping techniques, hypnic techniques to calm the mind and help you to relax. Family education is also very important for emotional support. Self care, rest, nutrition, gentle physical activities such as yoga or nature walks can help you take care of your PPD.
Okay.
At the Society for Complementary Therapies, we offer mental health support services that can be helpful if you or someone you know is struggling with postpartum depression in complete confidentiality.
Thank you, ma'am, for giving your time and making all of us understand what PPD is and how we can offer that support to a new mother. Thank you so much.